Hello everyone. Today we'll discuss managing a dental hygiene patient with leukemia, a blood cancer that affects infection control and blood clotting. It can cause oral issues like gum bleeding, mucositis, and infections. Let's explore a case scenario to understand how to provide safe and effective care. Let's meet our patient. She is a 30-year-old patient which diagnosed with acute myeloid leukemia 6 months ago. She is undergoing chemotherapy and presents with complaints of gum bleeding during brushing and oral sensitivity. The medication that she is taking are chemotherapy regimen, anti-nausea medication, and a prophylactic antifungal. During the oral exam, her gingiva has sign of erythematous, deep purple color, gingival hyperplasia, and bleeding upon slight provocation. Her oral mucosa presence of petechia and ulcerations, primarily on the radial border of the tongue and the buccal mucosa. She also has moderate plaque buildup with minimal calculus. About her teeth, there weren't any sign of decay, but report generalized sensitivity, and also she has sign of mild xerostomia. About the assessment and considerations, and about the medical status impact on her oral health. Leukemia and chemotherapy compromise immunity and clotting ability, leading to increased risk of oral infections, bleeding, and delayed healing. And also xerostomia and oral mucositis are side effects of chemotherapy, contributing to discomfort and potential bacterial growth.
Some dental hygiene challenges can include the risk of excessive bleeding during procedures, pain and discomfort during scaling or instrumentation due to mucosal sensitivity, and potential for delayed healing or secondary infection post treatment. Pre treatment preparations can include obtaining medical clearance from her hematologist oncologist to ensure that her platelet count, which helps with blood clotting, and neutrophil count, white blood cells that help fight off infections, are suitable for treatment. We can also recommend her to use a non alcoholic antimicrobial rinse to reduce bacteria before her appointment. During treatment, we can perform a traumatic gentle scaling with manual instruments to minimize tissue damage, and use gauze with light pressure to manage any minor bleeding during the procedure. And we should also avoid irritants like ultrasonic scalers if sensitivity is a concern. We would also teach her how to brush gently with an ultra soft toothbrush, such as fluoride toothpaste to protect her teeth and non alcoholic mouth rinses to soothe her gums. We would also recommend frequent sipping of water and sugar free lozenges to combat xerostomia. And for post treatment recommendations, I would advise her to avoid spicy, acidic, or crunchy foods that can irritate her mouth, and to provide her with written instructions to reinforce oral hygiene tips and monitor her symptoms. For OHI, we recommend using a soft bristle toothbrush, fluoridated toothpaste, and an alcohol-free mouthwash. In conclusion, managing a dental hygiene patient with leukemia requires careful planning, gentle techniques, and close collaboration with the patient's medical team. Also, addressing their unique needs ensures a safe and effective and compassionate care. And here are our two questions. Number one, along with gingival hyperplasia, what two colors could the gingiva present as in patients with leukemia? And number two, why do we need to know the patient's platelet and neutrophil counts? And that's our presentation. Thank you.